we're going to go in alphabetical order for our foremothers. Our first honoree is Ruth Lubic, and I'm not going to read her bio because you can read it yourselves, but I just want to say that it's an honor to honor you, and when I had the opportunity to go to your clinic, it was just so inspiring. It was really wonderful, and how great it is to provide the kind of health care that we all deserve to some of the lowest income families in this city, and how important that is. So thank you so much.
It's not us midwives, it's the wonderful families we serve. Joni?
Oh,
You love now.
Oh, you gotta stand up.
It is my distinct honor to be an awardee of this prestigious organization, along with Dr. Omega Logan Silva and Diane Reed. I thank Catherine Weymouth for her kind opening words as well. We awardees have been asked to speak briefly about how times have changed, or not, for women over the years. I would like to do this from two perspectives. First, that of the management of the childbirth experience in the 1950s when my son Douglas was born. You'd never believe that I pushed him out. The acceptance and utilization of midwives in this country in a similar time frame. Keep in mind that my husband, Bill, and I are children of the Great Depression. Here he is. And we're taught to live frugally and to care about folks less fortunate than ourselves. Birth in the 1950s was often managed by the routine use of Demerol, a painkiller, and scopolamine, an amnesiac, so that women would not remember the experience. Laboring women, there were no family members permitted, were restricted to a bed with padded side rails so that their erratic drug-induced behavior would not harm them or their fetuses. And when moved to the delivery room, had their hands cuffed in, I'm sorry about this, in leather bracelets on this side of the delivery table, so that they could not touch their clean baby with their dirty hands. How destructive of a mother's instincts to hold and provide needed bonding with a new baby, and how destructive of her perceptions of her ability to be a good mother when she might have vague memories of her negative behavior in labor. Today there are differing settings to cater to the mother and family's choices, with the nurse-midwife operated freestanding birth center being the one with which I am most familiar. The original childbearing center in Manhattan's Carnegie Hill neighborhood was set up to offer sensitive care to young families who, disenchanted with conventional care, were engaging in do-it-yourself home birth, with little or no prenatal care and fathers catching their babies, a potentially very unsafe plan. So the success of the CBC evoked a response from hospitals in the form of in-hospital birth rooms, which for the most part convert to standard delivery rooms, and even when fathers are present, usually do not offer any control or even partnership to the laboring family. I would be remiss not to mention today's rapid growth of cesarean section in the United States, from 10.4% of all deliveries in 1975 to 31.8% in 2007, which not necessarily cause, but certainly are coupled with an alarming increase in maternal deaths from 6.6 deaths per 100,000 live births in 1987 to 13.3 deaths per 100,000 in 2006. Amnesty International, which last week conducted a briefing on the House side of the Congress, reported on this phenomenon in its recent publication, Deadly Delivery, the Maternal Health Care Crisis in the United States. From the point of view of midwifery, In the 1950s, the last of the foreign midwives were being prohibited from practicing, and prepared nurse midwives from one of the 8 schools, including Yale, Columbia, Hopkins, in addition to Maternity Center Association, had barely a toehold. Indeed, in some hospitals, a nurse did not acknowledge her preparation in midwifery. Job loss could develop. In the 1960s, there were very few jobs in midwifery, and then in '71, a joint statement developed by the American College of Nurse Midwives and the American College of Obstetricians and Gynecologists was put into effect. Jobs increased very little, but licensure became more available. Then in 1975, the freestanding birth center came on the scene and offered a home for the midwifery model of care, which you will see when you accept our warm invitation to visit the Family Health and Birth Center at 801 17th Street Northeast, and I mean that sincerely. You have to get in touch with us and come and see. Hopefully, health reform's attention to nurse-managed centers will enable the opportunity to visit others as well in the district, which has the highest infant mortality and maternal mortality in the country, here in the nation's capital. The success of the Family Health and Birth Center with its midwives, its nurse practitioners, its breastfeeding peer counselors, and community health outreach workers, placed as it is in a collaboration with case management and early childhood education, is becoming legendary in its service to the primarily African American families seen, those with the worst of the so-called intractable infant outcomes. They are not intractable. 2006 Family Health and Birth Center outcomes include reduction of preterm birth by 2/3, of low birth weight by 3/4, and cesarean section by 2/3, while providing evidence of cost savings greater than its operating costs of over $1.5 million. But most important is the empowerment of the women to take charge of their health and the health and lives of their families, bringing the unrealized talents of the African American 12% of our population to the forefront, and doing so through the provision of respect to those women who are so often disrespected by healthcare providers. How else, ladies and gentlemen, will the United States be able to compete in a global economy? Thank you.
Themselves instead of making long introductions. Oh,
I have something for you too.
Oh, thank you.
This is an award to Diana for the whole organization and its staff in doing so much for mothers and families.
Thank you so much.